everybody, it's Dr. Joe and Mr. Spider Bear, and today I'm going to show you my top 7 treatments for SI joint pain. So let's get started. Disclaimer alert, disclaimer alert. So the first thing that I like to do with SI joint pain is to do some muscle energy techniques, and that's MET for short. And basically what you're doing is you're using your muscles to get everything back into place. So if your SI joint is out of place, this is what you would want to do. Now, don't ask me which one is out because I can't tell without getting to evaluate you. You need to have your doctor or physical therapist tell you what side is rotated, if it's an anterior rotation or if it's a posterior rotation. So what you're going to do is if it's, let's say, a posterior rotation on my left leg here, then you're going to bring your left leg up and then you're going to put your hands on your leg here. You're going to have the other one down. You can put a little roll underneath if you want to as a target, but you don't have to. And so what you're going to do basically is use your hip flexors on this side, your hamstrings on the other side to kind of rotate it back into place. So if I'm this way, I'm using those hip flexors to rotate it back. So I'm going to put my hands here, and what I'm doing is I'm pushing up this way and pushing down into the floor here at the same time. I'm pushing as hard as I comfortably can for about 5 seconds. So you're not going anywhere. You're pushing into your hands and down into the floor for about that 5 seconds, hard as you comfortably can, and relax. So again, make sure you know which way it's rotated because you only want to do the one side that's rotated. You don't want to alternate back and forth. That's why it's really important for this one to know. So if you don't know, go ahead and skip this one and then go on to the other one. So you want to do that 3 to 5 times for 5 seconds, pushing as hard as you comfortably can, up this way, down that way. So then the next one is what we call a shotgun technique. So with the shotguns, you're going to start off with getting a belt or a strap, but you want it to be something tight. So this is not those resistive bands. You want it to be something that doesn't give. And you're just going to take that belt and put it on your thighs just above your knee. And so while I'm putting this on, I want to take a second to thank my channel members on YouTube. And so if I say your name wrong, I'm sorry, I apologize. But Dead Spartan, Pavin M, Jean A, Susan C, and Janet B. Thank you so much for being channel members. And if you're interested in being a channel member, make sure and check down the description link below. All right, so once you get this on, you're going to get back into this position, and now you're pushing out into the belt. So it's almost like you're opening up like a clamshell or a butterfly. So I'm pushing out this way with both legs. So it's almost like I'm trying to drop them flat. And I'm pushing into that belt hard as I comfortably can again for about that 5 seconds and then relax. Now sometimes if your SI joint is out of alignment a little bit, you might feel a little pop with this shotgun technique. As long as it's a pop and then it goes away, that's probably just that joint popping back into place. So that's completely normal. So again, pushing out this way, both sides, push, 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 hard as you comfortably can for about that 5 seconds, and do that 3 to 5 times. So then the second part of the shotgun technique is now we're just going to go the other way. So now when you're squeezing in, you can use a basketball, soccer ball, something again firm and solid. If you don't have something like this, you can use a pillow, but you want it to be pretty big where your knees are kind of still about shoulder width apart. The exact distance doesn't have to be that much, but you don't want to use like a little lacrosse ball or tennis ball. You want it to be something fairly big. And so now this time you're pushing into the ball. You're squeezing that same thing, that 5 seconds hard as you comfortably can. Most of the time when I do this with people, the squeezing in is the one where they feel a pop, if they're going to feel it. You're not always going to feel it, but if you do, a lot of times, because this is opening up that joint. Now when I'm pushing in, it's fanning that pelvic area out, and sometimes you get a little pop. Completely normal, as long as maybe it's just a little bit of pain and then it goes away immediately. So again, 5 seconds, big push as hard as you comfortably can, and then relax, and do that 3 to 5 times. So then the next one, you're gonna lie on your side with the side that's uncomfortable up on top. So now let's say it's on my right side, just so I can look at you while I'm talking. So I'm gonna lie down, kind of get in a comfortable position. I might prop up throughout this just so I can see you a little bit better, but make sure you're comfortable. So if you need to lie all the way down, make sure you're comfortable while you're doing it. So this is kind of a weird technique, but it usually works pretty well. So you're gonna feel back behind you where your SI joint is. Where that SI joint is, it's basically where the spine or that sacrum comes into the pelvis or that ilium. So sacroiliac joint. And it's usually, if you look at someone's back where it looks like they have little dimples on the low part of their back, that's where that SI joint is. You can usually feel it as kind of a little knot back there. And that's what I want you to take your thumb and just push into that joint. So you're going to give it a little pressure there, like you're just trying to push it inwards. So while you're pushing inwards, you're going to take that top leg, bring that hip up kind of into flexion, and drop it on the floor in front of you. You can do this on the bed too. If you can't get down on the floor, that's fine. You can do these on your bed or on a couch. So after you come into this position, you're going to come up, kick the leg out behind you, and then drop down. Now the key is try to be pushing into that SI joint the whole time. And so by doing this movement, again, sometimes it helps it just kind of pop back into place. So just repeat this a couple times. So now I'm going to come up and then bring that knee up and bring it down. So just nice smooth motions, but always kind of come up, kick it out, and then drop it down. Don't just come back and forth like this, because that's going to irritate your IT band. So make sure when you come back up, you're lifting up, bending up that knee, dropping down, up, kick out behind you, and then come back down. So I would just say, maybe do about 5 of these. You don't have to, go too crazy with it. You can do 5, maybe 2 sets of 5 a couple times a day throughout the day, just to kind of get that thing nice and loosened up. So then the next one is going to be a hip flexor stretch. I usually like doing a hip flexor stretch kind of in the lunge position. If you're stretching out your hip flexors, because sometimes it's tight on one side and then weak on the other side. So you want to get them nice and stretched out. So when you get into the lunge position for the hip flexor stretch, I like putting a pillow underneath my knee just because it protects it a little bit. So especially if you're on a harder surface, make sure you put something under there. So the side you want to stretch is going to be the one that's down. So my left side is the one that I want to stretch for that hip flexor. Put your other foot a little bit further out in front of you. And the goal with this to get the best stretch is keep your upper body straight. So I'm not bending forward like this. I'm getting no stretch in my hip flexor right now because see, it's still kind of straight through there. So I want to keep this upright and then lunge my whole body forward, and I should feel that stretch right through there. So if that hip flexor is tight and it's pulling on that joint to rotate it forward, then I'm getting it nice and stretched out. So since this is a stretch, you want to hold that stretch for 30 seconds, come back and do that a total of 3 times. Now, you can do both sides. You probably really want to focus on the side that's tight, but I always like to stretch both sides if you can, just to keep everything balanced. So then after you stretch out the hip flexors, then you want to stretch out the hamstrings in the back, because it's the same thing. If you have a tight hamstring on one side, it's going to then be pulling it into that posterior rotation. So there's a whole bunch of different ways to stretch your hamstrings. I'm going to show you standing up. So for the hamstring stretch standing up, I like it because it's really easy to do. You can do it anywhere. Just take the side that you want to stretch and kind of prop it out in front of you. Just prop up your heel like this. Now, if you have a little bit of balance issues, make sure you're holding on to something while you're stretching so you can focus on the stretch and not your balance. Make sure you're bending at your hips and try and keep your back fairly straight, because if I'm just curling down like this, I'm not really getting much of a hamstring stretch. I want to keep that back straight and kind of hinge at my hips to get that stretch. Yeah, I'm getting much more of a stretch here than when I was going all the way down touching my toes. So again, since this is a stretch, you want to hold it for 30 seconds. You should feel it kind of through here, and then do that a total of 3 times. So again, switching both sides just to kind of keep yourself balanced, 3 times on each side. I like to alternate back and forth. If you want to do them all on one side, you can. So to finish up, I'm going to show you a couple exercises. Once you kind of get everything nice and stretched out, hopefully get it back into alignment, you really want to then do some exercises. So the first one of the exercises is a hip hike. And so with hip hikes, it's kind of just how it sounds. You can do it on a step to give you more of a hike, but when you're starting off, I think it's better just to do it standing on the floor because with the step you're going to get more of a motion. So really what you're doing is just trying to hike up your hip. So I usually just put my legs slightly out in front of me, and then what I'm doing is I'm just hiking that hip. So this one's coming up, but I'm also working this one. So you're really working both sides in different ways. This is an open chain, kind of bringing it up here, working that side, and this is a closed chain. So I've heard people kind of argue the hip hikes, what side are you working? I really think you're working both sides. So this one is really important to do both sides each way because it's an open chain, closed chain. So just hiking up and coming back down, just like that. So it's not bending over to hike it up. You're using these muscles to hike that hip up. So again, make sure you're switching sides because it's working those hips in different ways. So I'm just trying to lift that hip up. I'm hiking it up. And so these are a little tough to master. So I would just start off with 5 on each side, do that a couple times a day, and then you can slowly progress from there. And so the last one is going to be a deep squat. So it's an exercise, but it's kind of finishing off with a stretch too. So if you're still out of alignment, sometimes a really deep squat kind of helps get you back into alignment as well. So this one, if you have something solid to hold on to, a lot of times with a deep squat, that's the best way to do is kind of hold on to something. So spread your feet out, shoulder width apart, maybe a little bit more than shoulder width apart. So a deep squat is really kind of like when you see babies squat. Babies do the perfect squat. That's how you're supposed to squat. For some reason, as we grow up, we forget how to do it. But as babies, you know, when you kind of see them down like this, so that's kind of a deep squat. But see how my knees are still not going past my toes. So if I'm squatting down like this, that's a really bad way to squat. You really want to sink that bottom back. This is really tough for some people, so you might not be able to get into that deep squat. That's okay. This is just another technique to use. But again, when you're coming down, you want those knees to still be behind the toes. So I'm squatting, but if I had something to hold on to, I could kind of balance a little bit. I can do it a little bit. That's just because I practice these things every day with my patients, so I can do them a little bit easier. But if you're doing it the first time, this might be a little bit tough. But again, that's going to sometimes help kind of reset it. And then when you come back up, you're really working all those muscles as well. So it's tough. You might not be able to do it, but it is an option if you can. So there you have it. Those were my top 7 treatments for SI joint pain. Yes, it was. If you'd like to help support my channel, make sure and click on the link up there. And don't forget to subscribe where, Bear? Down there. And remember, be safe, have fun, and I hope you feel better soon.